Hello, we are from SGDB2 and we are going to present our student project with the topic of Herpes Symplex virus type 2. My name is Jona Fortanira with the last 3 digits of student number 039. Next. This is the list of our group members. Next. The table of contents consists of Chapter 1 Introduction, Chapter 2 Literature Review, and Chapter 3 Summary. Next. For Chapter 1 Introduction, starting with the background. Next. Genitalia as the organs of the reproductive system of female and male consist of the internal and external parts. Herpes simplex virus type 2 is one of the common causes for infection in genitalia resulting in genital herpes. As one of the most common sexually transmitted infections, HSV-2 has approximately affected 22% of adults older than age 12 in the United States. A study about epidemiology of HSV-2 infection in Asia proved as the etiological cause of 76% of genital herpes cases. The increasing numbers of cases in transmission of HIV have also been linked to HSV-2 infections, as it increased the risk of acquiring HIV nearly threefold. Next. Most people with genital herpes usually appear asymptomatic and unrecognized, thus resulting in increasing numbers of STI cases because of the transmission to neonates or sex partners. Exposure to the fluids containing the viral product from a seropositive individual often happen in sexual intercourse. Virologic tests using the type-specific molecular and type-specific serology can be used to diagnose genital herpes. The next one will be explained by my friend. Thank you.
Hello, my name is Madeline and my registration number is 093, and now I will discuss about the definition of herpes simplex virus. Herpes simplex virus is one of the most common sexually transmitted infections. It can be divided into two, which are type 1 and type 2. These viruses are enveloped in DNA virus, which are sensitive into environmental factors and disinfectant. Herpes simplex virus type 2 mostly affect in genital lesions, but also can occur in newborns. Both type 1 and type 2 are rarely come with symptoms and unrecognized, but when it comes to symptoms, it can cause painful ulcers, and HSV infections is lifelong and medications are used to reduce the symptoms. Thank you.
Hello everyone, my name is Dava Satriananda, student number 146. I'll explain about the etiology. Infections of genital herpes are spread through exposure with the virus itself by direct contact through surfaces of the mucous, herpes lesions, and oral or genital secretions. However, in some cases, herpes can be transmitted through normal appearing skin or genital and oral mucus. It is also common that genital herpes are spread through sexual intercourse. However, it is also possible that herpes can be transmitted through oral sex. The only thing differs is that when a patient receives oral sex from type 1 herpes patient, the virus that spreads are the type 1 herpes virus. It is also common in finding patients who are infected through people who are clueless of them having one or through asymptomatic patients of herpes. Pregnant women having primary or recurrent herpes can also pass on the disease by intrauterine transmissions, leading to congenital herpes infections into the fetus.
My name is Jennifer Jasma Gunawan with student number 068. Genital herpes due to herpes simplex virus type 2 infections is one of the most common sexually transmitted diseases. In 2012, around 417 million people globally are reported to have HSV type 2 infection. According to WHO, the prevalence of HSV-2 infection is the highest in Africa, nearly triple the rate of the global infection rate, 32% compared to 11%. In America, around 23 million cases are reported every year. Between 2005 to 2010, 16% patients aged 14 to 49 years old are positive in serology testing for HSV-2. The presence of HSV-2 antibodies is often related to sexual activity of each individual. Females are found more often to be infected, with increasing prevalence as the number of sexual partners increase. An estimate of 85 to 90% of infections remain undetected and undiagnosed.
Hello, my name is Abhidhanova Prambudu with 3-digit student number 124, and I want to explain about pathophysiology. The HSV-2 infection is transmitted by direct contact and specifically affect the skin and skin membranes. The virus in the skin will attack epithelial cell and replicate at the site during the initial exposure period of approximately 10 to 14 days. Then the virus will dormant or inactive in the periaxonal sheath of sensory nerves in several places, namely in the trigeminal, cervical, lumbosacral, or autonomic nervous system. And the virus will reactivate when the immune system decreases, and the virus will go to the mucocutaneous site and then replicate and go to the dermatological area of sensory neurons.
My name is Nika Deguna, number 25. So the histopathology of herpes simplex virus type 2 has an extensive lymphoid infiltrate with atypical lymphoid in its histopathology. And the clinical features of herpes simplex virus type 2 include the presence of a typical lesion of intraepidermal blister, which is the main feature is acantholysis with solitary keratinocyte within the blister cavity. And changes due to the viral infection are shown by changes in the shape of the keratinocyte nucleus. And the changes include the nuclear chromatin multinucleation and nuclear inclusion. And in viral inclusion, the small pink deposits were found with a clear halo in the nucleus. And during the initial vacuolation, cytoplasm can be seen along the basal keratinocyte. And later, when the cell swells and separated, that the cytoplasm become eosinophilic, especially in multinucleated cells, and mix in the inflammatory infiltrate.
My name is Wilson Aldim, student number 149, and I explain the diagnosis. Diagnosis can be started from history and physical examination. For the signs and symptoms that can be shown is genital ulcers due to pain, scars and crust, tenderness due to lymphadenopathy and dysuria. And for the systemic signs such as fever, headache, and malaise. We can find papular and macular lesion are frequently seen on the skin with the development of mucous membrane into vesicle with an onset of up to 3 weeks. And these lesions are very painful and can cause swelling of the vulva, burning sensation, and dysuria. Next, for the supporting examination, we can use 4 methods. With the first method is direct swab of vesicular lesion. We have to avoid the swab on healed lesion, and this examination can be performed 72 hours after onset. Next, if using a direct swab still fails, we can try for HSV polymerase chain reaction. For the third method, HSV serotyping can be done to determine the type of HSV between type 1 and type 2. And last one, Bisang smear is rarely used because of its weak sensitivity and inability to differentiate between HSV serotypes. Thank you.
Hello, my name is Bagus Rinagastya with 3-digit student number 032. Early and appropriate treatment can provide a better prognosis, namely the duration of the disease is shorter and the incidence of recurrence decreases. Providing education is also an important aspect in the treatment of genital herpes simplex. Patients should be advised for recontrol, advised not to have sex while the lesion and symptoms are still present, use condom, and check their sexual partners. Specific treatment can be done by giving antiviral drugs against HSV infection. Antiviral drugs that are now widely used are acyclovir. Besides, there are 2 types of new antiviral drugs, valaciclovir and famaciclovir. The effect of these antiviral drugs has not been able to eradicate the virus, but only reducing viral shedding, shortening the illness period, and reducing recurrence. All patients with first episode should be treated with oral antivirus drugs. Treatment given early can reduce systemic symptoms and prevent local extension to the upper genital tract. Symptomatic and antiviral treatment is acyclovir 5 to 100 mg per day per oral for 7 until 10 days, or 3 for 100 milligrams. If there are severe complications, intravenous acyclovir can be given 10 mg per kilogram body weight per day for 7 until 10 days. Thank you.
Hello, my name is Putra Binyamasar Nadika, student number 239. I will explain about the differential diagnosis of herpes simplex virus 2. In establishing the diagnosis of SSP2, it's necessary to consider several differential diagnoses as possible as other disease. The differential diagnosis can come from infectious and non-infectious disease. In infectious disease, ulcerative conditions such as lymphogranuloma venereum, syphilis, granuloma inguinale, and cancroid. In non-infectious genital ulcerative conditions such as Barrett syndrome, Crohn's disease, sexual trauma, psoriasis, and fixed drug eruption. SSV2 infection in genital area is related to an increased risk of HIV infection. As a result, be aware that HIV testing may affect the therapy of SSV2.
Hello, my name is Anggara with student number 194. SSV2 is incurable. Early identification and administration of pharmacotherapy can suppress its early viral replication. While abstinence of sex can reduce its transmissions, this disease also has high morbidity with low mortality rate and long-term risk of disability.
Hello, my name is Dona Ulis Daruk, student number 165. There are some complications that caused by herpes simplex virus type 2 infection or HSV2 infection, such as neonatal HSV disease, HIV infection, acute aseptic meningitis, encephalitis, meningoencephalitis, ascending myelitis, radiculopathy, cranial neuropathy, and acute retinal necrosis. Neonatal HSV disease is the most commonly considered as a complication of HSV2 infection in pregnancy. Neonatal HSV has a high risk of mortality in infants with complication of disseminated disease and neurologic morbidity in infants with complication of CNS disease. HIV and genital HSV2 infection known to be had a reciprocal biological interaction. HSV2 has been found to increase HIV acquisitions in the genital tract during HSV2 shedding. Besides, HIV infection has a high risk of co-infection with HSV2. Acute aseptic meningitis occurs in 36% of women with primary HSV2 genital infection and 13% of men. Although infection of HSV2 generally cause meningitis, any part of neuroaxis may be affected by this virus, including the retina, brainstem, cranial nerve, spinal cord, and nerve roots. Acute retinal necrosis presents with association of HSV2 meningoencephalitis. Examination result will reveal episcleritis or scleritis, keratic precipitates, retinal vasculitis, and necrosis with retinal detachment. Thank you.
Student number 234, I want to conclude our presentation about herpes simplex virus type 2. And oral or genital secretion. The diagnosis of HSV type 2 can be studied from anamnesis about the patient's history of sexual relations and personal history related to sex. Furthermore, on physical examination, HSV type 2 will mostly attack the genitalia, which shows ulcers or even asymptomatic. Specific treatment can be done by giving antiviral drugs against HSV infection, such as acyclovir. The prognosis for HSV type 2 is associated with high morbidity but doesn't have a large impact on mortality rate.